Senate Human Services Committee, House Healthcare Availability and Accessibility Committee. Am I on? Thank you. Welcome, everybody. This morning, I would like to advise you that ABC TV, CBS Channel 2, CAN TV, Herald News, Chicago Tribune, NBC Chicago have leave to record, as well as Telemundo and BlueRoomStream.com. Would the clerk please call the roll for the Senate committee?
Senator McGuire, Senator Nybo, Senator Ryder, Senator Oberweis, Bivens, Severson, Staines, Hunter, Bush, Aquino, Biss, Morrison.
Present. Thank you. Could we now ask the House committee to take roll for its members?
Mr. Clerk, would you please call the roll for the access, healthcare, and availability, as well as the other members that's joining us today, please?
Flowers.
Present.
Tabaris. Demmer. Conyers Irvin.
Present.
McAuliffe. Ford. Here. Harris. Connor.
Present.
Willis.
Here. Thank you. I'd like to make an introductory comment and then ask Chairwoman Flowers to do the same. The purpose of this committee today is to take testimony on the role of DCFS in the Crosby case. This is not a court of law, and we will not be taking testimony for the purpose of implicating individuals in any criminal activity. That investigation remains open under the jurisdiction of the Will County Sheriff. Rather, as state legislators, it is our goal today to hear about the interaction of DCFS with the residents of 309 Lewis Street. DCFS is being asked to advise us after their own internal investigation on what mistakes occurred, and most importantly, what specific changes have been put into place to prevent those from happening again. Representative Flowers?
Thank you, Senator. And my remarks are going to be very brief. There are thousands of Semajs out there. And for too long, DCFS has been failing the children of the state. We have a systematic problem that has never been addressed. And today, I want this to be the beginning of the never should have happened to never happen again, because we're talking about children's lives. Too much money has been expended, too much time, and we're not getting the best, and the children of this state is not getting the best. So without any further ado, thank you very much, Senator, for joining us today, and you want to start?
Thank you. I would like to ask the members of an organization called Justice for Semaj Action Team to come forward first and provide testimony. Amy Sanchez, Latoya Robinson, Mireya Reyes, and Raquel Anaya. Sorry if I didn't pronounce your names correctly. If you're in the room, I wonder if you'd come forward, please.
And Senator, while they're coming forward, I would like to add Representative McAuliffe to the roll, as well as Representative Conyers. Okay, thank you. Mm-hmm.
Ladies, please have a seat. Make yourself comfortable. Oh, Amy, if you would like, your organization is going to testify first. So do you want to come on up to the table, please? So this morning, we would like you to make your remarks to the committee. We would ask that you try to confine your remarks to about 5 minutes each, if you could. When you turn the microphone on, you'll be pushing that button until you get a green light that flashes in front of you. So please start by identifying yourself, and we're anxious to hear what you have to say this morning. Thank you for being here.
Good morning. My name is Amy Sanchez. I'm a committee member for the Justice for Semaj Action Team. Did you want us each to identify ourselves first, or? Okay, good morning. First of all, I'd like to thank you all for hosting this committee hearings. I think they're very important, especially in the wake of the passing of Semaj. I came before you to testify about my personal experience with the Department of Children and Family Services. In 2002, I was a young mother of four children all under the age of 3. I had an experience personally where my husband at the time spanked my son. And I knew he had disciplined him, I knew he had gotten a spanking, but the next morning I saw and witnessed bruises on my son's butt, my eldest son, on his butt and on his legs, deep bruises with welts in the center of the bruise. And immediately, as a scared young mother, I took him to the emergency room. I was upset. I told my ex-husband, what did you do? You obviously used too much force. And of course, DCFS was involved as we took him to the emergency room. The DCFS caseworker that came out to investigate the scenario looked at the photos of my son and talked to my ex-husband in private, and in front of other family members made the remarks, "Oh, it's because of his light skin. She doesn't know how we do our kids," referring to the race of my husband and the race of my children. And she closed the case as unfounded and just said, it's good that you have 2 parents in the household, and I should be appreciative of that. That was my first experience with DCFS. I worked very hard to raise my children the best I can. And in 2011, I had another experience with DCFS when my niece was shaken by her biological father. And she is now a shaken baby syndrome survivor. She's 6 years old, and she has the capacity of a 3.5-month-old. When DCFS became involved, the investigator did an excellent job. He came in, he removed my older niece from the household, placed her in my home. My sister went through aggressive parenting and lessons and everything that DCFS put her through. While I had custody of my niece as a DCFS foster parent, the caseworker initially was contracted out to a specific agency that DCFS no longer does business with or has a relationship with. And their relationship was parting. It was at the end of their relationship, DCFS and this contracted agency. I did not hear from that caseworker for 6 full months. I left messages. I called her supervisor at this contracted agency. I called the DCFS office. And lo and behold, when it was time to have our hearing at our local DCFS office with the liaison from the DCFS office, Will County, and this caseworker, this caseworker walked in and had a pile of notes and had information and tried to take over the case. She knew she had ordered these services, and I firmly but boldly told her, "You are not a fit caseworker. I've been calling you. I've been reaching out to you, and the most important person in this whole scenario are my nieces, who I had care of the one, and the other one was still in the hospital." I informed her that it was because of caseworkers like her that didn't care that children became lost in the cracks and in the shuffles. And I said, and I happen to be a foster parent who cares. My nieces are important to me. There are some people that are just doing their due diligence as foster parents that have no relation to theirs. So it's easy in situations like this. And the caseworker got agitated with me, and she went on and on to tell me why I was wrong and I was going to lose custody of my niece if I asked for a different caseworker. But the DCFS liaison at the office even told me after the meeting that I was doing the right thing by standing up for my niece. Standing up for children is not something that is new to me. It's always been what I've been taught to do and what I do. The day that Semaj went missing, I had never met her. I had never met her family. It was the right thing to do for the right reasons, to go search for this baby girl. And I restricted any judgment, as I still try to do now, as to what happened and what occurred to the proper investigators. Let the criminal investigation go on, and let's wrap our arms around what we can do. A lot of the people in the community came together and have several questions unanswered. But when the DCFS investigative report, that 22-page report came out, it literally took my breath away. At page 8, I had to stop reading it. I got sick to my stomach. Former Director Sheldon acknowledged that there may have been some missteps, but at this point, I don't believe the agency has accepted those recommendations made in that report. So my testimony today would be to urge DCFS to accept those recommendations and to look within itself as senators, as the committee hears the different testimonies. There was no time that any government agency that walked into that home couldn't have done the right things for the right reasons. If the current legislation and the current policies that DCFS has states that squalor or deplorable conditions are not enough reason to remove a child from a home, if that is still the case after these proceedings move forward, which we're hoping changes are made, there's nothing wrong with calling the Will County Land Use Department and saying, hey, we had an incident here. However, I think it might be worth an investigation or a visit on decent, safe, and sanitary housekeeping for this home. And if they made a decision that that home was inhabitable, DCFS could then make the proper steps. There could have been another agency that DCFS was well aware of, the Housing Authority of Joliet. You could have picked up the phone and called a caseworker. You could have picked up the phone and got right through to the executive director. He's very accessible. And said, I think this home needs to be inspected. I think a routine inspection needs to be done. I think an emergency inspection needs to be done on decent, safe, and sanitary housekeeping. And that may have spurred, if you know you're going to lose your Section 8 voucher, if you know that that's at jeopardy, it could have definitely changed the course of some actions. I don't know that any one person in this room knows what could have saved Semaj that night, but I do know that there are many, many missteps on many parts, including us as a community, that we've stepped up and stepped forward and said, let's take a look at ourselves and what we've done wrong to turn a blind eye that children and people can be living in this condition right under our noses and we not do something about it. I urge this committee to reevaluate not just the policies of DCFS, but what audits are done to take place to help good caseworkers that need extra tools and support, that want to do the right things, and to weed out those caseworkers that don't need to be part of the DCFS agency or a subcontracted agency. I would also ask briefly to reevaluate the policies in place for incentivizing closing out of cases early beforehand. I know that there's been reports about pressure among high for that reason, and I would ask that you reevaluate that as well.
Thank you, Ms. Sanchez. Could I ask your colleague next to you then?
I'm LaToya Robinson. I'm also a member of the Justice for Semaj Action Team. I'm also Semaj's godmother. I come here today because I was angry. I read the DCFS report, and it opened my eyes to what was going on in that house. I had no idea. The mother, she shut me out. She didn't want me to know those things. So when I read the DCFS report, I was shocked. It's the first time I heard that this was going on. Being her godmother, I was supposed to protect her. My issue is, even now, there's a possibility that her brothers could go back to that. The progress that they've made, they've learned new things, and it is a possibility that they can go back to that. That hurts. I don't want any other child to suffer. I don't want to lose another godchild. I just want changes to be made. I don't want nothing like this to ever happen again. It hurts. It really do.
My name is Maria Reyes. My daughter, Raquel Anaya, age 5, was not able to make it with me today, but she did have a message to give you. I recently watched, I'm with the Justice for Semaj Action Team as well, resident of Joliet, concerned citizen of Joliet, because there are killers on the loose. We are in danger. I feel that those responsible for Semaj's death are out there. There's an investigation going on. Okay, we'll be patient. I'm not going nowhere. I demand justice for Semaj. I demand reform. My daughter has a message. She knows all about Semaj. When she's sleeping, she talks in her sleep. She says Semaj. She's only 5. We watched a movie recently, Lilo and Stitch, 2002. Social worker, Cobra Bubbles. I have a picture. If Disney can get it right, they know what a social worker should be like. If you don't know who Cobra Bubbles is, he's fierce. That is who should be protecting our children. Now, I know in reality we can't all look like this, but when it comes to children, we should be fierce lions protecting them. Every child we neglect to help, we all pay the price later. Manuel Aguilar, Eliana Claiborne, Jasmine Walker, Semaj Crosby, we demand justice. As a community, I am not going to be desensitized, and this is not going to be the norm for me or my child. What am I teaching her? Semaj doesn't matter? We just shove this under the couch? She was, how many months old? 16? 16-month-old baby. She fought. She fought hard. She fought too hard. Manny Aguilar, 4 years old. He was the same age as my daughter when he died. This hit me hard. He didn't deserve to have his teeth knocked out by his parent, so-called mother monster, to hide his identity because she didn't want to get caught. Think about the mentality. These caseworkers are going into these homes. Where is your gut instinct? Where is all your psychology courses? When is that all going to come into place? I don't have a degree in social work, but I have heart, I have compassion, I have gut instinct that could cut someone. Here's my resume. DCFS, hire me. Hire me. My objective, to protect all children with active DCF cases, to become their advocate so that voices will be heard, so that no child is left behind. But my bachelor's degree is no good. I have to stand behind this microphone and be their voice, be Semaj's, be Manny Aguilar's voice. Where are they? 6 feet under. They're 6 feet under. They should be playing outside in the playground. They should be in school. They should be eating healthy meals. They should be going to doctor visits. According to the Chicago Tribune, May 11, 2011, Cook County abuse and neglect cases closed within 14 days. In 2015, 5%. March 2017, almost 15% cases are being closed. Rewards being granted. I'm asking for reform. In the Blue Star program, more needs to be looked at. And the indictment of Mr. George Sheldon. This is just uncalled for. Who are we as people to allow these caseworkers to miss all of these important clues? We have failed our children. I'm not going to be held responsible. If you want to have that on your conscience, I can't. I will fight. I will fight for them, fight for the voiceless, fight for the little ones who need help. I just don't understand how we have allowed this to happen. Thank you.
Thank you. We really appreciate your remarks. And the purpose of this hearing is to find out what happened so it'll never happen again. And thank you very much for being concerned. Are there questions from members of the committee? Thank you.
Thank you, each of you, for being brave, for your commitment, for your empathy, and for being a voice of those children who can't be here today. Thank you guys for coming. Appreciate it. We'll now be taking testimony from members of DCFS. Beverly Walker, the acting director of DCFS. Michael Rupe, the Senior Deputy Director of Operations, and Desiree Silva, Regional Administrator. If you all like to come up together. Welcome. Thank you for being here this morning. Director, would you like to begin?
That would be helpful, wouldn't it? I also want to add my thanks to the three young ladies for their passion and for their concern and for their commitment to holding those of us who are responsible for children and families when they are not in their best circumstances, to hold us accountable and to speak on behalf of children that may not be served well. Good morning, Chairperson Morrison, Chairperson Flowers, honored senators and representatives. I'm going to give a statement, and I have two of my wonderful side folks who will be available to talk. My name, as you know, is B.J. Walker, and I serve for the last 4 weeks as the director of the Illinois Department of Children and Family Services. Like many of us here today, I've lived a rather privileged life. Even when my family was poor and 4 of us were living in one room, sharing a kitchen and a bathroom with 3 other families in an area they now call Bronzeville, but one we used to know as the low end. But my privilege was not one of economics, but of strong parenting and neighborhood support. The result for my siblings and I was protection and well-being. Most of us turned out all right. Tragically, that was not the story of Semaj Crosby and her mother and siblings. From what we know so far, Semaj's mother, Sherry Gordon, was waging a valiant but ultimately losing battle to survive and take care of her children as best she could in the face of dire poverty and challenging conditions, over which she seemingly had limited ability to manage and control. Her child's death is a weight on us all. While today we do not fully understand what happened to Semaj, as an agency, we have had a chance to step back and reflect on some things within our control that did not happen with that family. We at DCFS are really first responders when families and neighborhoods are failing children. We are called. It's our job to arrive at the scene, assess the situation, and then act, do something to help. Yet, we need to remind ourselves that we are not in control of all the factors and that we are dealing with human behaviors, those inside the dynamics of the family and their situation, as well as our own. Both the families and our own workers are wrestling with forces that are not always obvious at the moment, but which may become painfully obvious in hindsight. DCFS workers do some of the most difficult work there is. Many people think that my job is hard, and it is somewhat, but it is not nearly as hard as the work confronting those who work with me on the front line. These workers are responding to life's most complex situations. Each time, not sometimes, each time, they face the awesome decision of taking the kids or leaving the kids. Neither comes without real consequences for the child. We often forget about what it means for a child to be pulled from her family. It inflicts a wound so deep that it may never fully heal. It is a traumatic experience that can be as enduring as the neglect or physical abuse that initially brought the child into our line of sight. When we make a decision to leave children with their parents, it's really not about the adults, it's about the kids, because they want it so bad. Our job, therefore, is to carefully contemplate the risks and then support our decision with a full court press. We often find that what we are doing on the front line is not a binary choice between safety and danger. Vulnerable families live complicated and convoluted lives. We often find ourselves needing not just to evaluate safety, but also needing to evaluate risk and well-being, which may not be as straightforward. That is what our frontline investigators have to do every day: protect the safety of children while at the same time deal with the ever-evolving conditions and dynamics of struggling families. That calls for us to have a sharper focus on a broader range of issues, many of which are qualitative and not really quantitative in nature. As first responders, we have to contemplate the risk on both sides and then bear the burden of what we decide. But we can never forget that in any one situation, such as the one we are here today to discuss, we may need to reevaluate that decision over and over again. Today, as part of this discussion, we will share with you some of our ongoing reevaluation of our policies and practices. Something that began with the quality assurance report that former Director Shelton initiated in April. With me at the table today are Michael Roop, our Senior Deputy for Operations, and Desiree Silva, Administrator of the Northern Region, which includes Joliet. I have others in the room who are available to answer questions as they come up. In addition, during my first week here, I asked Casey Family Programs to come in and add an outsider's look into our work on this case and to expand that lens over the next few months to help us review our entire front-end practice. Specifically, how can we improve the interactions that need to take place between the hotline, the investigation staff, and those who are providing our intact services. I want you to know that we're not sitting here, however, waiting on their full analysis. We've been engaged in taking a hard look at ourselves at every level. But I want to assure you that this look is something that will always be continuous. We're not going to simply make a couple of changes in procedure and pronounce the job done. I want to assure you that this work has our most urgent attention, and after we make improvements, we will continuously assess them and make more improvements as issues emerge. Everything we currently understand about Semaj A. Crosby's mother, Cherie Gordon, suggests that things started falling apart for her and that she had limited ability to manage a steadily devolving situation that brought a plethora of people into her home, challenging her ability to effectively manage her already limited parenting and housekeeping responsibilities. Every case doesn't look like this. This was really a perfect storm that combined poverty, a struggling child, a mother's impaired abilities, and an intrusion of people who suddenly made the burdens of day-to-day life insurmountable. Based on what we have come to understand about this family situation and those of families like them, we are right now focused on 4 very specific action steps. The first is to create management tools that do not exist at this time or have not existed prior to now. Right now, as a staff, from the management level down to the front line, we are too often flying blind. It's like we're bowling through a curtain. We've not had reports to help us understand the current divide between what we are doing in investigations and what is going on with intact cases. When there are open investigations on intact cases, that is a red flag indicator, and it should be, that a potentially risky situation has crossed the line past mere risk. We missed those connections in this case. We now have developed reports that help us understand whether there are open investigations of intact cases, where those cases are, and which providers or staff are managing the cases. I know you're asking because I did. How can that be? I can only say that from this day forward, we will know more about what this risk looks like, and we will be able to both manage our work and communicate that information to providers so they can manage better as well. New alerts will come daily to both us and our provider partners. In addition to better mining of our data, we have reinstated comprehensive practice reviews that involve our frontline staff, supervisors, and administrators to examine what is happening and what more needs to be done in the most high-risk cases. This is going to be a tremendous learning experience for all of those involved. So this is not a mere policy and procedure announcement. This is asking people to pull themselves up to the table of very high-risk cases and collectively hold themselves responsible for looking at the work. We'll see what kind of focus we really need to put on these families when we see a new investigation, and particularly when that investigation involves a family that's already come to our attention and is receiving intact services. So that's the first category. We need to be able to manage the work in front of us better, and we needed information, reports to help us with that. Second, we are instituting or initiating what I am calling a 360-degree case management model in cases involving our most vulnerable children and families. All cases we see are not equal. Some children and families need a more comprehensive view than we currently give them. They need a 360-degree focus on the child, the family, the situation they're in. And they need us to pull in the most comprehensive set of resources across the state and within that local community. We are still putting finishing touches on the design and development of this approach, but it is not something that will take us weeks to do, because all we've done is ratchet up what is good casework practice and turned it into an intense experience that our staff will be asked to deliver. But we already know that these 3 categories of cases could most definitively benefit from this more comprehensive look. Families and cases with children under 3 years old. Cases where a parent has a mental health, behavioral health, or a cognitive functioning disability. And cases where we encounter children living in extreme, toxic environmental conditions and in a situation where a lot of unrelated and unknown adults are coming and going in the household. Third, we are expanding the opportunities our frontline has to get actionable, accurate information about each family we touch as early as we possibly can in the investigatory process. We're not always able to see critical trends soon enough to intervene early enough. We will therefore be changing our use of number sequencing, which you noticed in the quality assurance report, to help us identify cases that we have touched before. Currently, we do not have a reliable way to identify prior unfounded cases and understand that if we've been to see a family 5 or 6 times and it's unfounded, that we should ratchet that up for a different look. But we have, prior to this, not had a way to do that. The changes we will make will correct that. To the extent possible, with our current technology, and most assuredly in whatever new technologies we develop, we will also be looking at tools for matching cases with variable spellings, different names, and common addresses. Up until this point, we had not been able to reliably search addresses across names and variable spellings. Finally, we are carefully reviewing our entire front-end practice, starting with the hotline, including the interaction between the investigations unit and the intact family services. We are tapping into Casey Family Program's ability to take a national look and bring a national perspective and match best practices across the country with our strengths and weaknesses. But again, I want to assure you that we are not just sitting here waiting on this input. Our own management team, with input from the front line, has also rolled up our sleeves and started working through the data, our technology capabilities, and our practices, searching for ways to improve our line of sight on children and our ability to respond. not quite ready for your full consideration, but certainly on our radar, is consideration of legislative changes that may help in cases like this. In particular, we're looking at ways to improve our ability to hold parents who come to our attention more accountable for cooperating with what we ask them to do. At the front end, when we are conducting investigations and while we are working with them in the intact families practice. I want you to know cooperation with the department now is voluntary unless the case goes to court. We may want to rethink that as well as expand legal authority of the department to compel background checks for adults who are affiliated with households we are investigating and serving as part of intact families that we are working with. I trust that we can put our heads together along with our partners in the judiciary and think about some of these issues and what kinds of legislative action might help. We, as a department, thank you for this opportunity to engage in this critical examination and dialogue, and we look forward to responding to your questions and comments. Thank you.
Thank you, Director Walker. Other questions from the committee?
Representative Ford has a question.
Thank you, Leader Flowers. Thank you, Director, for your thorough testimony. Just a few questions. The first one is, do you believe that DCFS lives up to its name, the Department of Children and Family Services, and if it's possible for it to even live up to the name, given your testimony that you've just given?
I believe that not only do we try to live to that name, I believe it is quite possible for us to expand our collective vision about what that means. The Department of Children and Family Services is the emergency room for troubled families. And when we see them, our job is to sort out as many difficult issues as we can that are confronting these families while protecting children. The safety of children stands at the heart of what we do, but risk and well-being and permanency are the long-term ways in which we go about doing that work, and the children deserve a full tilt look at it. So I believe we can stand up to that name, and I believe that our responsibility, one of my moral imperatives when I come to work every day, is that my job is to bring to the table the tools that allow my frontline staff to get it right each and every time. And so we all have a job to play in that mission, and that's what I bring to work, but I believe it's quite possible.
And it says on your website, DCFS has the primary responsibility of protecting children through investigation or suspected abuse or neglect by parents and other caregivers. So we talk about abuse and neglect. What's a red flag of abuse? Is it physical only?
No.
Okay. And neglect, at what point does the department, what are the red flags for neglect?
Well, I will ask Michael to speak to that, but let me just introduce how to think about it. Oh, if only we had a clear delineation of what that looked like. There is a standard and a statute, and it defines what the state of Illinois considers to be abuse and neglect. And so we use that as a guide, but that is the guide we use to make our decision. But when we come into a family, there's a wide spectrum of things we're looking at. But I'll turn to Michael.
Could we?
And, yeah.
We'd like to continue questions for you, Director, and then we will go to Mike.
Oh,
Right.
Thank
sure.
you.
And so when we know that there is possible abuse and neglect, the Department of Children and Family Services, even while an investigation is going on, are there services directed to the families immediately, because we know that there are possible challenges for the family? I mean, or do we wait until the findings are determined?
No.
Do we send services to the families immediately?
When we're making a response, we have available a wealth of services that are available to families that we bring to bear throughout the investigatory process. So that if we're going in and we see a family that needs a particular service, even as we are investigating, we bring those services to bear, we connect them, we make them available to them. That's
And-
as full an answer as I, at the director level, can give you. Clearly, Michael and Desiree can talk about it from the point of view of details.
And I just have two more questions, because I know that there's a lot of questions. So we know, and I've heard this many times, that hurt people hurt people. And do you think that our social workers, case workers, investigators are trained in order to detect behavioral health problems? And who do they report to for advice? Does the Department of Children and Family Service have a chief medical officer that they could work with to report what they may feel could be behavioral health problems for a parent, and who advises them moving forward?
We do have a chief medical officer. We have a clinical department with staff who have certifications and skill sets across the full spectrum. In the new model that I talked about, where we're meeting families where mental health, behavioral health, cognitive dysfunctions are on the table, we will be making memorandums of understanding. I just spoke with Secretary Demas yesterday to make sure that we can reach out to the mental health resources that are locally paid for by the Department of Human Services. So we have places for consultation, and we're going to increase the intensity with which we use those resources and the ways in which we use those resources.
And I said I had two. This is my last one. I do believe that if we're going to deal with situations where the state has to come into a family's life, we have to look at it from a human service position and not as a way of criminalizing a family, because I would think that parents would rather get help on a human service level rather than getting the criminal justice system involved. And we have to figure out the best approach. And so my recommendation is the best approach is to deal with this from a strictly behavioral health standpoint. That's my.
We will take that into consideration as a way of looking at it. I do think there are times when the struggles of parents have become so overwhelming that they often are not making the best kinds of decisions as parents. And so part of our job is to both find help, offer help, get them connected to resources from a behavioral health point of view, but also hold them accountable because their children want it so bad. Their children want their parents to get well enough to parent them. And sometimes that calls for a little bit more of accountability perspective rather than just simply the perspective of, did I give them services, but how am I helping them really change their mindset about what their children need and why they need it.
Please add Senator Hunter to the roll. Senator McGuire?
Thank you, Madam Chair. Director Walker, it's good to see you again.
You as well.
I want to commend you for the dispatch with which you've addressed the situation that existed at 309 Lewis Road, Semaj A. Crosby's last home. There's been mention made of the quality assurance review and how distressing it is to read that. And my impression, having read and reread that quality assurance review, is that Semaj A's mother, Cherie Gordon, was overmatched, and DCFS was overmatched, and the Intact Family Services provider was overmatched. And so I hope you'll receive my questions in a spirit of partnership as we try to discover how we can improve DCFS and its contractors to attain the goals of assuring the safety and well-being of every child in DCFS's care. I want to start with some basic questions. Let me, if I may, construct a scale from 1 to 10 of the cases that DCFS has, 1 being complex, 5 being more complex, 10 being most complex. And where would you place the situation at 309 Lewis Road on that scale of 1 being complex, 5 being more complex, and 10 being most complex?
So the Semaj A case began in April of 2015, and it was April of 2017 when the child passed. I would say that along the spectrum of 24 months, this case probably had a number of different, by your system, a number of different numerical tags that you might want to attach to it. At the beginning, it was probably toward the lesser end. Clearly, in the couple of months before Semaj A died, it had reached the upper limits. We missed some of that. We looked at it as episodes. I thought, just in fairness to how it happened from my perspective, who's coming in with hindsight all on my side, we missed because we were looking at it from an episodic point of view. So each episode, each time we went out, each time someone entered the house, they were looking at it through a small episodic lens. And as the family situation devolved and began to become more and more high risk, and the well-being of children in that home the prospects for well-being for children in that home began to deteriorate, we're still looking at it from an episodic point of view and a safety point of view merely. Just on the day that I'm here, are the children safe? When what we need is to expand the lens so that we're not just looking at episodes, but we're looking at trends. Some of our new data tools will allow us to see the case over a trend level, see the 2 years in front of us, not each and every incident at a time. So that's how I would use your numerical scaling to suggest that it went from the low end to the high end, and that the high end is a place where we, as it comes to get into the upper limits of your scale, that's where we would want to use and convene with a 360 approach so that we're no longer just looking at individual episodes and incidents.
I appreciate that. Could you tell us how many individual child protection investigators visited the home? How many separate individual different Intact Family Services staff members visited the home over that 2-year period?
I can't right here tell you the exact number. I know it was too many. Different ones. Too many different ones. That's what I would assess. That we had a number of them. And again, that goes back to the episode. If I come in today and I look and I see something, but then 6 or 8 months later, another person comes in and looks, they're looking at it from scratch. Right. You know, they don't have the benefit of the prior look. And so I don't have the exact number for you. Perhaps Desi or Mike might have that, but I do not have it. Do you have it? Yes, I do. Okay. So.
Okay. I'd like to ask you about the initiation of Intact Family Services to Semaj and her fellow family members. The Quality Assurance Review suggests that Intact Family Services were initiated only after the 3rd DCFS investigation. Is that true?
I don't know if it's true. Again, I would ask Michael and Desi with regard to case specifics, whether that was true or not.
Okay. Well, perhaps a fair question for me to ask is, what does stimulate the start of Intact Family Services?
A concern that the situation in a family puts the kids at some risk of not being safe, and a consideration that services would greatly raise the profile of safety for children in that home. But I want to point out that if it's unfounded or it's indicated, it could be a substantiated or it could be unsubstantiated in terms of the abuse and neglect allegation, we have the ability to offer intact services to either one. I want to stress, though, in our state, that's a voluntary service. The parent can refuse even in an indicated case of abuse and neglect.
I want to make sure I understand the sequence. So is this the sequence? That an allegation of abuse or neglect is received by DCFS, DCFS investigates, and then perhaps DCFS begins Intact Family Services?
I'm saying that the investigation is what we do on every allegation that comes in, and we accept it through the hotline. So while we're investigating, we make a determination, founded or unfounded. When we make that determination, we can also say to a family, even if I didn't find that it was abuse and neglect, but I see that you're vulnerable, you have some needs, I can offer you services. And if it's indicated, but it's a low-risk indication, and we're not overly worried about the safety of the children, but we are worried about perhaps the parent's ability to really do a strong parenting job, or we just want to keep our eyes on helping that family make sure they can take care of the kids and that everything's okay. But either time, when we offer the services, they're all voluntary. They may take them or not. Even when they go over to Intact Services, they can still refuse to do services that are offered to them. It's their choice.
Okay. I'd like to ask you about the investigations that occurred during the time Intact Family Services were being provided. Then I'd like to ask you about the almost termination of Intact Family Services, and then I'll allow other members of the committee to ask questions. Again, my reading of the Quality Assurance Review Acting Director is that after the Intact Family Services case was opened on September 23rd, 16, subsequently there were 7 investigations.
That sounds right.
And as far as coordination between the Intact Family Services provider and DCFS itself, the Quality Assurance Review notes that in 3 cases, there's no documentation of communication between the Intact Family Services provider and DCFS. There was communication in 2 cases. Perhaps there was communication in 1. And in the Quality Assurance Review, there's no mention, either way, in 2 cases of whether there was communication between DCFS and the Intact Family Services provider. So again, I welcome your dedication to improving the services we provide to families. So could you tell specifically what you're going to do to ensure that the Intact Family Services provider knows that an investigation has been opened by DCFS?
Starting yesterday, we are each day running a report that gives us all open investigations on any Intact Family case around the state. So when that report comes out, we will know by provider, by region, and by family name and address where an open investigation is on an Intact case. We are also going to provide that to the Intact Family Provider Agency daily as well. So now at both sides, both at the area office, say in Joliet, as well as at one of the providers who does Intact services in that area, both will get a daily report of all open Intact cases for all Intact families that are being served.
And what might the result of that daily notification be?
Well, on our end, the result of that daily notification is that we're going to pull those cases, and we're going to have the area administrator convene staff around what eyes are we putting on those families, what's going on with this case, making a contact to the provider organization. And on the provider end of things, I know if I were a provider, I'd probably wake up with my hair on fire and go running and trying to figure out which one of my cases has taken another level of risk, and what can I do with my staff to make sure that we do everything we can to diminish the risk that an open investigation suggests.
Thank you. That's encouraging. And finally, I want to ask you about a passage on page 7 of the Quality Assurance Review. It's the third full paragraph, I believe.
What, page 7?
Yeah, page 7.
Okay.
And the third full paragraph. And the second to last line, third to last line, Director, says this: the family case had been set to be closed prior to the initiation of this investigation. And a couple lines before that, it's noted that, well, I'll read the whole passage. The Intact caseworker was contacted by the CPI and did not have concerns related to the allegations, but did report parenting classes had not been completed due to transportation issues. So, of course, these are parenting classes which Cherie Gordon was to be attending but was unable to attend due to transportation issues. So despite that admission by the Intact caseworker that Cherie Gordon was unable to complete the parenting classes, it appears that the Intact caseworker planned to terminate Intact Family Services to the family.
It does appear, from what we're reading, that was their intention. Reading things like that did suggest to us that we needed to have this review done of our complete front end with regard to investigations and Intact families. From my experience before coming to Illinois, the Intact family caseload is probably one of the most high-risk case areas of our business. And you might say, why? Because you've assigned someone to work with the family, but actually these are the families who are at high risk of not being able to sustain their homes and protect their children in a way that we would hope they would. And so they deserve a little bit more attention than even in investigations, because in investigations, we have a protocol. We have a set of things that we do. They are clearly tied to a standard of abuse and neglect. There are a lot of standards in the investigations arena that we may need to look at in regards to our Intact families. Around the country, if you look at some of the data, Intact families, some places call them family preservation, is an arena that often gets a lot of investigations. But people have a tendency to think, oh, we got our eyes on the family. But most of the time, those families are high risk, and we need to keep very close eyes on them. And so I've asked Casey to help us take a look at that, and we'll make adjustments accordingly. Because I would be disturbed, or it would have been disturbing, if this case had been closed, even as as new investigations were coming in on it.
Thank you, and I look forward to continuing to work together with you.
Thank you, Senator.
Director Walker, I have just a couple quick questions, and then I know my colleagues in the House have some questions. Your first 2 points about the management tools that are needed for your frontline. You just discussed a new alert system that's going to be available for intact families. What about the investigator who goes out to a home where there have been 5 or 6 unfounded investigations? Will they have any opportunity to know what kind of home they're walking into and what's happened?
That is a very serious concern, and as part of what we are doing in our action steps, we're taking the current sequencing procedure that we use. I will try to make sure that I explain it without over-convoluting it. But now, if I come to your home and you've been reported, and I do an investigation and it's unfounded, I assigned your case a number, and while I'm investigating, it has an A, and that case is your case, and it's 3167A. I unfound it, everything's done. But then a month later, I come back to your house. Because it was an unfounded allegation, the system gives you a totally new number and an A again. So I could come to your house every month and unfound the allegation and never know that you had a prior case a month ago or 4 months ago. And so what we're asking to do is, and it's a complicated environment because there are some allegations, even if they're indicated or founded, that are expunged after a year, and some that are expunged after 3 years. And so in the midst of that environment, what we're going to do is to continue the alphabet each time we come and investigate for allegation that we've received on you.
And
So
what's the timeline on that? How soon are you going to have that tool available for your investigators?
I believe it's weeks.
Is that something they've got this afternoon if they go out and investigate this
No,
afternoon?
we have to change the technology, right?
Yes, but we've already
So-
started that conversation
We-
with our
But what does
technology
that
department.
mean? What does that mean in real life, in a real timeline?
Well, I will tell you this. Last Thursday, I told them I needed a report on how many open investigations there are on in tax cases, and I had it yesterday morning. So we have a sense of urgency now, and perhaps we've always had one, but I have a sense of urgency about some of these tools we need to manage with. And so we will be rapidly developing the capability that each investigation will now go A, B, C. So if I'm at your house and it's F, or even if it's C or D, that's gonna ratchet up my sense of what's going on. It will also search by address, and we're gonna do some things around name spellings. That's more complicated, and we're gonna look at software around that. But if we with address and the sequencing, it's gonna take us light years ahead of knowing, and the worker knowing when they go out there what's going on or what could be going on.
I mean, I'm glad to hear that you are able to get that report. I want to make sure that you understand how critical it is, and I know you do, but I'm going to say this. Those people in the field need it. They are the ones that
Absolutely.
need that instantaneous access when they're going to doors. The other point that you make is a 360-degree focus. and you made the remark that you want to make sure that you have accurate information immediately. As the investigator walks in, they're getting correct and accurate information. My understanding on Semaj's case was that, and I know there were numerous investigations, we don't even know the number, we're not even saying how many people were actually in the home, that at one point they went to the door because there were children she was babysitting that were apparently unsupervised, something brought that investigator to the door. Mrs. Gordon said those were her children. That case was opened voluntarily because she identified non-related children as her own children, and that it's only a fluke. The DCFS even opened a case. So how are we going to verify the information? What kind of tools are you going to use to make sure that we actually know that is the mother of those kids? Can you give me any thoughts on that?
We're going to, when people tell us untruths, it becomes part of our investigatory process to ferret out the truth. So when we open the door and somebody is not telling us the truth, but then when we have a system of sequencing now which is aligned with address, it's going to start to bring to the surface things that the caseworker never had before available to them to help them understand who are they looking at, what are they looking at. Now when we have an interaction between the intact family caseworker and the investigations worker that we're going to link together, now we're going to have someone who perhaps knows a little more truth than we were told in investigations, and those workers can begin to validate and verify what's going on. We must investigate, and so the investigatory tools will be more available to us, and our interactions are going to be much more intentional than they have been to make sure that people who are in a house, in the same house, know they've been there and can have a conversation about what they're seeing.
When your investigators go to a home and they announce themselves, do they declare to the adults that they're speaking to that falsehoods and lying can and will escalate the case and may, in fact, cause the removal of the child? Is there any statement ever made to the family that's being investigated so they know that this is serious?
I'm not sure that we say that, but I'm not sure.
Okay.
I can't answer that.
Okay, thank you. I know that Chairman Flowers has some questions.
Thank you, Senator. Madam Director, as I stated to you earlier, what I have to say and do is not personally directed at you. It is the situation that I have been observing over the last 30 some odd years in regards to our children and DCFS. And your comments today, quite frankly, is very disturbing to me, because it tells me that nothing is going to change. Part of your opening remarks was about sequencing. It's about numbers, not about the children. Then you talked about how you're going to implement this 360-degree plan. Well, that's full circle. That means they're going to end up where they started out. We don't want that. Nothing that you've indicated today do I think is in the best interest of the child nor the family. Now, if I may, I'm trying to slow down. This report is criminal. This report should not be, because it wasn't done on these days. The reports were done after the death of the child. One paragraph says everything is fine. Another paragraph says the family has problem. Then the following paragraph says everything is fine. They're about to go out to get ice cream. And the next paragraph says Semaj is dead. What? And the taxpayers paid for this. And let's go back to the sequencing. Is there a pay for performance involved with DCFS?
No?
Are you sure?
Well,
Can-
I've been here 4 weeks,
Right.
not under my 4 weeks.
So let me ask, is there a pay for performance addressing DCFS?
No.
No.
Okay, so then explain to me, in regards to the sequencing or the lack of sequencing, because these are just a bunch of numbers, do you have the report, the Office of Quality Enhancement and Clinical Review, the joint report, do you have that?
Yes.
So I am curious to know, because there is a pattern here. The numbers are not pattern, but there is a pattern. So after the first sequential number is, that I want to refer you to, is on page 3. That's not the first number, but that's the one I want to refer you to. And it's the first paragraph, I'm sorry, the first paragraph where the number is, the SCR 217, do you see that?
I do.
Okay. Then it goes on to talk about this report resulted in Father James Crosby being the indicated perpetrator of allegation number 11, cut, bruises, and welts, abrasions, and oral injuries. Now, what is allegation number 11?
I'm going to have to defer to the folks who do the field work.
That's actually the cuts, what you read about the cuts, bruises, welts, and abrasions. So the allegation pertains to those types of injuries.
Okay. And then, as a result of that, those allegations, law enforcement agencies' leads came in. Results for both parents were documented. And also, domestic violence. Someone from the domestic violence was brought in. Am I correct?
No, I don't believe so. In those situations, we do a screening to ask the adults about if there's any domestic violence occurring in their home or with other significant persons in their life. The same as far as talking to them about any substance use issues, so that if, in fact, we do identify such, that we can make the appropriate service referrals.
Okay. Well, I read it to be something different, but it looked like to me that there was about 3 or 4 different agencies that was brought in. But let me just kind of go back just a little bit. When your workers walk into a family home, when they walk into a home, the first thing they need to do is respect the family. That's number one. The second thing they need to do is to be offered a seat and assess the situation. See, the worker would have known Semaj's mom would have been telling the truth had the worker spoke to Semaj's mom and asked for the proper identification of the children. Had the worker asked the mother to identify herself as being the mom, and she would have done that, she would have showed the ID. She did tell them that she had a disability, but obviously no ID was ever asked for. But the worker eventually did assess the home to find out that there were some problems in the homes. But what I really found interesting is between the intact family and the investigator, no one offered any help to the family. Now, we do have the Norman funds. See, what you're talking about doing, you don't have to do because the law is plain and clear. The rules, the guidelines, the procedures, the policies. Why wasn't the Norman funds brought into this family? It was an intact family, and the mother said, my son needs help. I can't get his prescription filled. The Medicaid card had expired. She didn't have food stamps. Where was your workers? Why didn't they call the other department, the Department of Human Services or someone, that says, reinstate this mom's Medicaid card? We have a child here with a pre-existing condition. And if the worker didn't want to take the mom to the doctor or hospital herself, why didn't she call Uber? It wouldn't cost her anything because that's part of the normal funds. That's where she gets the money from. And if it was roach infested, and if the environment was not conducive, the Norman funds. Or you have other, instead of hiring all these outside contractors to assess the situation, assess the fact that the mother is mentally ill. She told you that. Assess the fact that she's only getting $700 and some odd a month. Can you live off $700 and some odd a month with 4 kids? Take into consideration that the other people that was in her home, she was forced to have those people in her home. She wasn't responsible for her own money. She had to have a payee. That payee told her what to do, when to do it, and how to do it. Were the children being given TANF in their name? See, these are the things that you're not talking about. These are the simple things that should have been addressed. Instead of being punitive, instead of talking about, I will come up with a new program, there's nothing new under the sun. This is just common sense. This is all about respect. What about the BH degree? The first one. And then I think there's this second triennial report. What about what they're saying? And I know the latest one stated that the implementation of the plan, despite the fact that the courts are aware that the Director Sheldon will not be here, but they expect their court order to go on. You haven't mentioned the court order. Do you understand that you're under a court order? Do you guys understand that you're under a court order and there are certain things that you have to do? Where is your accountability to the courts? These are the things that I want to know. Forget about your sequencing. Your numbers are irrelevant if they're not true. And what you're saying by those numbers is not true. And if the kids need help, why did your workers go out there? According to my calculations, it was 15 different times. Starting, as you stated, in 2015, up until the day that the baby was found dead. That's 2 years. No water, no bread, no lights, no money, no services. The child, her son, he was reaching out for help. The father, there was another open case because the father refused to take the son to the hospital again because he had just been released from the hospital. What the child needed was his medication. Did any of the workers even think to call Walgreens? If you don't want to go get it, call Walgreens. They'll deliver it. But oh no, they couldn't do that because the child wasn't on Medicaid. That redetermination wasn't done on the family with the child with a pre-existing condition, with a mom with a medical condition. And we cannot go around turning our nose up and putting people down because they're poor, overworked and underpaid and stressed. Where do people go for help? That's what the Department of Children and Family Services. The reason why I introduced the bill of intact family was to keep the families intact. Because as you testified to, that when you take a child away from their family, that causes more harm. And the average family really don't mean to cause problems to their children or their families or cause them hurt or pain, not unless something is wrong with them. But the fact of the matter is, a lot of families are just under stress. They're overworked. You know, your state agencies, they close at 5 o'clock. And if this mother was on TANF, you know, or food stamps, there's some things that she has to do in order to continue those services. And maybe she couldn't do her redetermination because she didn't have transportation. So until such time that your workers and your frontline workers and your management, that you all understand that you're not here to create havoc in people's lives. You're not here to create jobs and contracts for other people to enrich themselves off the backs of poor women and children who's guilty of being poor and they can't afford, they don't have the livelihood or the money to provide for their children. But I have to give the mom credit. See, she showed us in the beginning that she was capable of doing certain things. She was capable. It's very difficult. A lot of people can't get a Section 8, but she was able to do that. And despite the fact that in the report, it talked about how the rug needed to be clean. Your worker talked about it, but she did nothing about it, despite the fact that the money was there. So until such time there's a mindset and you adhere to what the policies are already, and you deal with what needs to be dealt with, we're going to continue to have these same problems. You're supposed to make the children first, not the contract. You're supposed to make the family first, not the contract. That's what it's all about. Now, would you agree that those things have not been happening? Would you agree that you haven't talked about the Norman funds? Would you agree that you haven't talked about the BH decree, the recent BH court order that you're under, and all the things that you have to do in order to be accountable to the state and to the courts? Do you know how long we've been under the BH decree? The courts are saying to us that we don't trust you, state of Illinois, to take care of the children. We have to watch over you to make sure. And even that's not even working. So, Madam Director, with all due respect, I would appreciate if you go back to the drawing board. And please don't go back to that house in Springfield that you all wanted me to visit. That's not real. That's part of the problem. That's made up stuff. I'm dealing with reality. You have to deal with families where they are, not in a makeshift house, not in make-believe. And if you have workers who don't know and can't respect, what is the purpose of having a house for training if the training is only for the DCFS workers, but yet you contract with outside vendors that can't come to the home to get the training? What is the point? Why did you build that house? Who got that contract? I just don't understand what it is that you're doing. And not you per se, because you just got here. Now, but it's on your watch. It's on you now, Madam Director, and I'm just trying to let you know that you don't have to reinvent. You don't have to come up with 4 points. Just deal with what's on the books and the policies already. If you know of a family that's living in certain condition, please use the Norman funds to move that family to a better neighborhood, to a better house. If you see a family with broken windows and broken furniture, use the Norman funds. Use the funds that you're supposed to use. If you see a family that's in need of medical services, this Human Services, Mental Health, DCFS, you all cannot work in your silos. That's what you were saying about these numbers. These are just independent numbers with nothing, no meaning attached. But this is the state of Illinois, not the state of DCFS or not the state of mental health. These should be coordinated services. There should be an app for that. Each one of your workers should have an app on their cell phones, on their computers, where they could push a button and one of these state agencies will know that services need to be provided at this address. Now, if you're going to come up with something, do that. Get Uber, get an app, and get some people with some common sense, please. Are there any other members for questions? Okay.
We have, I'd like to please add
Representative
Senator Biss to the roll, and we have Willis, Wallace, and Hunter on my list so far.
Okay, and since we can start with the senator now. No?
Representative Willis?
Thank you. I have a couple of procedural, I guess, questions for you. So your caseworkers, how large is the average caseworker's workload?
That's a complicated question.
Give me your best answer.
My best answer is that the national standards suggest that caseload should be somewhere between 15 and 18 per worker. Some workers are in that standards. We also have a BH decree that suggests that caseloads should be 9 months out the year, 12 cases, 3 months out the year, 15 cases. That's complicated too. That's why I'm saying it's complicated. We, just last week, started to produce, for the first time, a report that lists by worker what worker caseloads are, something we had not produced in recent history.
So you're telling me even though you had the BH decree that said that it's supposed to be at a certain way, nobody had a clue what you're really...
Not that they didn't have a clue. We didn't have a report so that I could look at and go down the list and look at it. I don't know, Michael.
Add a little bit of clarity, please. We had a report that would tell us the assignments and the average caseload. We're talking about investigators right now. However, it didn't compare it to the actual BH standard. So while you may be getting 12 for 9 months out of the year, to see that going on month by month by month, we did not have such capability. You had to look at each report on its own for each team, each region. And you could tell the assignments. But there were also some duplication issues because of people moving around, changing positions, or detailing to an office to help cover caseloads for investigators. The new report that we've developed will show us through the calendar year, every month, how many specifically are at that ratio, and it will also flag us as to a yield. Basically, you're getting close to being at your caseload max, so that we can track that more carefully all the way through to make sure that we're trying to abide by those caseloads. For the other part, more generalized in caseworker caseloads, the BH decree speaks to permanency or placement workers, and that caseload is 15 to 1. It doesn't speak specifically to intact. However, we do our best to try to keep them at 10 to 1. There may be workers that are higher. In the private sector, many times they have their workers carry both intact cases as well as placement cases.
All right. And then if your investigators run into a situation that is overwhelming to them for a variety of reasons, looking for additional assistance, who do they go to for that help?
They should go to their supervisor. They should be calling their supervisor up. As I understand, under former Director Sheldon, there were mobile phones finally added to the repertoire of our caseworkers. And so now they have the ability to get the supervisor on the phone. and talk with them about how complicated the case is and get advice about if needed.
Okay.
They can also reach out to other units within the department, such as our clinical unit, as well as our medical director or other staff that may fall under those umbrellas for assistance in difficult situations and challenges.
And then in the life of an open case, is it the same investigator that's going in there on a regular basis so they know the history of what's going on? Or is it a new person every time coming in, and so they're not getting the history? And if it is a new person, do they have access to what happened in the past? And I know you alluded to that a little bit, Director, about the need to, if a case is closed, to still get that history of the closed case, or certainly the unfounded case. But there's going to be times when something's going to be taken care of, and they may follow up with parenting classes, and then 4 months later, something else happens. Is there a way right now or in the very, very near future so that we know what the history is, so that you're going in, because information is golden, obviously?
Absolutely. And so speaking to the investigation side first, the supervisors assign those investigations to the workers. There are times when it may be the same worker many times if we're having that many investigations. There may be other reasons why if a worker is out that day or they're on another case, it may go to a different worker. But based on what we've seen with the Crosby case, also in developing the new tracking tools that we have, it's going to show us for every intact case, it shows us that investigation and who that investigator is. So yesterday when I was looking at this, I could tell you right off the bat, for one family, they have 2 investigations pending. It's the same investigator on both cases. So that will be a plus, and we can help track that and try to assign these to the same persons. On the Crosby case, I know one of the questions was how many investigators were involved, and there were 7 investigators. However, one of the investigators of those 7 did have 4 of the investigations. So there was one worker who was frequently in there from that side. On the intact side, when you assign a case and it's open for casework services, of course it's assigned to an intact worker. Hopefully, if that worker doesn't change positions or leave an agency, our preference is for that worker to maintain that case throughout the life of that case opening, to maintain that continuity of information and service. I want to go then to the last part of your question. The director also spoke to a little bit about, while it's the sequencing issue, for cases that are unfounded, based on the allegation, I think the director spoke to this, those will still be available for either up to from 1 to 3 years based on the type of allegation that was investigated. So those are still within our computer data system. The hard copies still reside in the field office where they occurred, so they are available. One of the difficulties was, and we're going to try to address this and come up with fixes, which we've already started, on the spellings of the names that were involved in this family and the different information that was coming forth each time we were out there. And so many of the investigators did look at the prior cases that they could locate based on what they had available to them, spelling-wise, those kinds of things at the time. However, unfortunately, no one ever looked at every single file. Once you got to that 10th investigation prior to the death, there might have been 4 or 5 of them reviewed, but maybe not all of them reviewed. So we need to fix that. But for right now, yes, that information is there to locate.
Well, and I think I would caution about using spellings of names. If you have common names, even the name Crosby is a very common name. Smith, my name's Willis. There's tons of Willises in the world. That's not going to help you. Even going to address location, I think you have a lot of people that tend to be transient in this. To pick off of something that Representative Flowers brought up, very important to me is that we look at the services as a whole. I think that is truly important. Many times when you have families in crisis, it's not just because there's alleged abuse or neglect in the family. There's usually something underlying in that, whether it means that they need to get mental health services, substance abuse services, food services, TANF, SNAP, however you want to look at it. All of those make into the overall health of the family. So I guess that brings me to the next question is, what are you doing to have all the different departments that of the state services work together That seems to be the most important part. It's not something we can very easily departmentalize. We can't say, okay, this department's only taking care of this, and this department's taking care of this, and if they're not talking to each other, how on earth are we doing the best to service that family, especially when the goal is to keep that family together by giving them services on family management, overall general health. What is your goal for that? I guess that's one of my biggest question. How are you going to fix that problem? Because that is a problem.
It is a problem, and our attempt to start a fix around it is that since we are touching that highly vulnerable family, probably at its most vulnerable place with safety for children, that we have to take some responsibility for convening the table and reaching out and bringing in the partners. When I was in Joliet and the senator and I had a conversation about how do we get these community resources, including those that are attached to state agencies, to the table around cases that we know need a full court press. And so it's going to start with us. I mean, you know, that everybody wants integration and collaboration, but somebody has to set the table. So because the kids and their safety is at risk, we're going to set that table. We're going to have our area administrator be responsible for reaching out, but I'm also reaching out to agency heads. I had a meeting with public health. I had a meeting with Mr. Demas in human services. We'll start with those because those are some critical and core services: maternal child health in the public health arena, the mental health, behavioral health, TANF food stamps, Medicaid. These are all things that we're going to have to assess if this is a issue and a barrier to this family being able to be strong enough that we can trust that they can protect their children, then we're going to have to convene those folks. I think if we start doing enough of that, then we'll start to collectively have a sense that this is supposed to happen. Not that it would be nice to happen, but that it must happen. And so we're going to start that work, and I've had conversations to begin that. And we're going to start with the most vulnerable families we see and let it expand from there. We have to grow a new practice. We have to learn and value a new way of doing business. And our front line, I believe, wants to do the best for every family. Our job is to get them the tools, convene the tools they need so they can get it right.
Okay, thank you very much. My final question goes back to your investigators and your workers. One of the reports that I was just reading stated that you are short staff, that you are understaffed. Do you have turnover? Is there a lack of qualifying people that are applying? Is it burnout from what you have? What would you say is your problem or your biggest obstacle to be adequately staffed so that we can take care of these families in crisis, offer them services? If you were going to look for someone to also oversee the entire well-being of the family, that's going to take more than a 15-minute check at the house, which I think is probably what's happening on some of your caseworkers now, unfortunately. What can we do, or what do you need to overcome this to be adequately staffed with qualified individuals so we never have another Semaji come forward?
From my perspective, we are challenged to have a full workforce. Like every other, when I talk to my colleagues around the country, not nary a one of them is fully staffed. The challenges, as you named them, are all there. So what we're doing is we're going to take a mentality of creating a pipeline. Right now, we treat staff vacancies as a serial event. Mary works for us. Mary quits. The day Mary quits, then we post. The posting stays a certain amount of time. Then we take it down. So we're not anticipating that we're going to have turnover, even though we have a history of turnover and we know what that history looks like right now. So instead of waiting for Mary to quit, we're going to start creating a pipeline and managing so that we have people who are at the ready to come into Mary's position when Mary leaves. And that's just not something we've done so far. It isn't a perfect solution to our workforce issues, but it will allow us to not put burdens and undue pressures on the people who decide to stay with us and make their job so difficult that they get burned out and either make mistakes or want to leave. So we've started to really understand and really break down and understand what can we put in the pipeline that still allows us to stay in head count and to stay within budget, but also have more people at the ready. It takes 6 to 8 weeks to get someone ready to go into the field. We know what that looks like, so we need to start managing to that reality rather than the reality of Mary quits and we fill Mary's job. That's a very critical thing that we're going to be doing. If we start to do that well enough, we're going to pull back on some of the ways in which we are currently challenging our current staff and making it difficult for them on a day-to-day basis to do the kind of job that they come to work to want to do. I don't know if if you think there's anything else to say on that score.
No, I think the only other thing is that we monitor this and have for many years on almost a daily basis. With headcount reports, our reports that we have on caseload within our computer system. Our employee services office works very closely with our budget and finance office and really has been proactive. If they know someone's going to retire in a month, go ahead and put that in so that we have the posting up, we have someone selected before that person actually ever leaves. And so I think with the enhancements that the director spoke about, with also having that pipeline way ahead to where we can feed already trained staff directly into vacancies in areas where we know we are challenged historically with having those. We're identifying those as hotspots throughout the state. And so we'll hopefully start to make a dent. To go on to one of your questions, though, about do you have enough qualified applicants? Many parts of the state, that's one of our greatest challenges, is that even when we call for the list from CMS, let's say we have 8 vacancies, we only have 5 candidates. Then you invite those 5 candidates for the interview, you might get a response from 3. 3 come, only 2 of them may score high enough to actually attain the score needed to take the position. Then they're offered, they can decline. You might end up with only 1 or 2 staff out of that whole pool we started with. And so we have to find a way, and we do recruitment, we have to find a way to get more qualified applicants, especially in certain counties of the state.
But I do want to say this. One, I think CMS has been really cooperating with us to shorten the time periods and the turnarounds that are challenging for us in filling our workforce. And secondarily, I want to send kudos, shout outs to the union because they've made some critical agreements with us in our high need areas to create pipelines and pools that we can draw upon that would allow us to not overburden staff. And so it again, like most of the stuff for us, it's a full court press. We get to do it when we engage our partners in helping us think about how do we problem solve. And so we'll look at the results of what we're doing right now, and it will help us know whether we need to ratchet it up a little more in order to make sure that we're filling all the vacancies as they become available, not after they've been available for 8 weeks.
Okay. Well, thank you, Director. I think I just want to reiterate that We don't need to reinvent the wheel. We need to finesse it. We have these services available throughout the state. We need to get them looked at universally, have interdepartmental cooperation to a much higher level so that we don't have families fall through the crack. It's been our goal at all times to keep the family intact as much as possible. We have the services there, and we just need to get each department to talk to each other much better and to have somebody to coordinate these. And I commend you that you're willing to pick up that task right now, and I look forward to working with you on that. Thank you.
Thank you.
Thank you, Representative Willis. Before we continue with questions from the committee, Ms. Silva, Mr. Rupe, did you have prepared testimony you wanted to provide, or are you here just to give answers?
Yeah.
We are coming up on noon.
We're just here to answer any questions you may have.
Okay, very good. Thank you. Representative Irvin.
Thank you, Madam Chair. Director Walker, thank you so much for being here today. You mentioned that you've only been in this position for 4 weeks.
Yes.
I really commend you. It seems as if you're well astute of the agency. I wouldn't want to be in your shoes within 4 weeks of sitting before this committee. As you can see, we are very passionate about this topic for very good reason.
Absolutely.
I do want to ask you a question. And if you don't know the answer, I ask that one of your staff will be able to whisper to you. But do you know the demographic makeup of the cases of DCFS?
I do not know them.
I don't have that with me today. That's something we can surely provide quickly to you, though.
We have no idea.
I don't have the statistics with me today. I don't want to speak out of turn, but we can get
I don't
that to
have the data either. We could pull it, though.
That's a very important question that I would have expected an answer for. But nevertheless, we do want you to succeed, Director Walker. As a matter of fact, I understand that your agency asked for an increase of 50 caseworkers for fiscal year 18, and I assume the governor appointed you to this position?
Yes, he did.
Okay, and in which the governor vetoed the budget that we passed, members of this committee, to help you to be successful, that you will be able to hire 50 additional caseworkers, that we were successful in overriding that veto, just to let you know. So we do have real good intentions of helping you to be successful. But in addition to that, I heard Mr. Rupe mention that sometimes, depending on areas of the state, that there may be 5 candidates available for a specific position. And that does make me question, when I look at the unemployment rate in the state of Illinois, no matter what area you're in, to me it should be far surpassed 5 candidates available to be interviewed for any position. You mentioned that you was working with CMS. I would encourage you to review the hiring process, because I know I represent the west side of Chicago, and there are many people that would love to be considered for these positions that I believe are available and ready. So I don't know what your outreach is, but I would encourage you to do a little bit more than what you're doing, because there are certainly way more candidates around the state of Illinois that are able and available to fill these positions. Now, even in these positions, you have 24 vacancies in Cook County currently, is that correct?
I don't have the Cook County numbers in front of me.
Anyone with you?
Yes, actually, we just filled approximately 20 positions that they were going to training, and then the pool prospect the director spoke about, we are hiring an additional 18 to fill those pools. So they will go into training as well, and as we experience vacancies or other issues such as leaves, those workers can then go into those, and in the meantime, they'll be helping the other workers that are currently working with their caseloads and other tasks or activities on their investigations.
Okay. So we would certainly, based upon the testimony and everything that we've learned today, we want to make certain to fill those positions ASAP. And again, there are many people that that are available to do that. But one last thing, kind of piggyback on Chairman Flowers when she mentioned about your opening statement, Director Walker. And again, I know you've been in this position for 4 weeks, and even what you proposed sounds great within 4 weeks. But I know that there is more to it, as Chairman Flowers indicated, that we do need you to go back to the drawing board for. One being, I don't know if I heard you mention the reviewing of the Blue Star program.
I didn't mention it, no. But here's what I can say about it. I understand there was a program. No such program exists at this time. We've made it very, very clear. I've made it clear that we are not going to be operating programs such as that as a way for us to get our work done and get it done well on behalf of children and families. So there is no longer a Blue Star program.
Okay, very good to know. Thank you. And again, we encourage you to continue in the work that you're doing. And today, it may have seemed challenging, but it's not, considering you've been in the office for, been in that position for 4 weeks. But if we come back to the table on next year, I can't guarantee that we'll be this kind. Thank you.
May I go back to the question you asked about demographics? So while I can't memorize every statistic, I try to have everything I can with me. So I do have it. So, and this is from the end of April of 2017. We serve, and these are the children and families are actually in our care that are receiving services placement-wise. And our statewide is African American is 48.4%, Caucasian is 41.6%. Latino is 8.5%, and then there's a very low, under 1% of other nationalities or races.
Okay, good to know. Thank you. The reason I asked that question is because I was just concerned of the governor's priorities, especially with the vetoing of the budget that includes the appropriations for hiring an additional 50 caseworkers. Thank you.
We're going to call on Senator Hunter, Representative Connor, and then a couple other members who would like to ask second questions.
Yeah, and Representative Ford also. Thank you.
Thank you, Madam Chair. Good to see you again, BJ.
Thank you, Senator.
You know, I once chaired the Human Services Committee, and I had big fights for years with the various directors of in your position. And I've made so many recommendations, you know, and I've talked so much about working with crisis families, troubled families, and I've given so many recommendations on how to improve the gaps that exist within DCFS. And it seems as though nobody really wanted to hear what I had to say. And so here we are today dealing with this crisis here. And, you know, I've always said that before I became a legislator, as you know, I was a therapist, and I had to make home visits. And, you know, I can go into a family's house and I can assess what's going on in the family in an hour, hour and a half. And I'd go back to the office and sit down with my supervisor, and I'd say, well, I witnessed this, I witnessed that, you know, and all you need to do is ask a few questions. And the answers you get, it'll tell you how many different agencies are involved with this family, you know? Because normally when you have actually 9 times out of 10, if you have a troubled family, there are multiple agencies working. It could be Department of Corrections, adult, juvenile, justice. It could be, you know, it could be anything, you know, and there could be some private agencies involved as well. And so what we've always done was, just like Representative Willis indicated, we would call all the different, we would find out who the case manager or who the therapist was for that particular family by picking up the phone and calling different departments. And we case manage, we bring all the interested parties involved. You know, we have one big meeting. Sometimes there's 15 agencies, 10 agencies in a room, you know. And everybody will go around the room and talk about their involvement with this particular family, you know. And we put together a comprehensive plan, And we'd work that plan so that we can help make this parent a better parent. Because, you know, what we found out is a lot of the gang banging that was going on came from these troubled families. If your kid is out here shooting or doing all kinds of stuff out in the streets, 9 times out of 10, the mama needs some help with something. Something is going on in that household, you know. And so it is not going to solve the problem just by locking that kid up or that person up. Mm-hmm. Somebody need to go out there and say, Mrs. Jones, Johnny just got arrested out here for doing whatever, whether it's drinking or if he ran away from home or whatever it is. Miss Jones, what's going on in your house? You know, is he in school? Is she in school? What do you need help with? You know? And so, you know, we keep having these hearings, you know, dealing with DCFS. And BJ, I was wondering, aren't there some kind of standard policies that exist within DCFS that regardless of who the director is, those standard policies should always stay in place? Because it seems to me that every time a new person come in, they got to imprint their own style. And once they imprint their own style, then they're constantly confusing everybody, the employees, the providers that are providing the services. Well, we have to do this now. No, we can't do that no more because he said that we couldn't do this no more, you know? And so I talked to so many employees over the years, and many of them are frustrated. And I believe that many of them, and I really hate to say this, I know that at one time they were genuinely concerned about the quality of life within the families in which they serve. But I can't say that too much today. I know that there are some staff that and providers that are very dedicated, but they get tired of all the changes going back and forth, and they can't get their job done. They don't have the supplies, they don't have the equipment that they need to get the job done, you know. And they just need some support every once in a while. And so I work with Representative Flowers on the intact family situation. We also worked together on the differential response, which was a program put in place to work with those families, you know. And so what did the director do? Come in, we don't need anything like that. So we just passed it again, and it's sitting on the governor's desk, and I would hope that he signs it into law, and that would hopefully become additional services that and support that you guys can use to do your job better, you know. But I mean, how many more hearings like this must we have? I suppose is the question, you know. And I would certainly hope that all of your staff are allowed to use whatever consent decrees that are out there. That's what they're there for. They're to be utilized, and there are dollars attached to those consent decrees. Use them. If these families need some help, give it to them. Give it to them so they can get out of your system and go on about their lives and raise their children and contribute to society. You know, I just don't understand why we have to continue to go through these problems year after year after year. You know, so that's all I have to say.
Representative Connor.
Thank you, Madam Chair. Madam Director, I'd like to thank you for appearing today. You and I have something in common because both of us have been in our current jobs for 4 weeks. So, and I understand the amount of courage it takes to step into a situation like this without a whole lot of background. My question is, and uniquely in this particular hearing, I came in from the Will County State's Attorney's Office, so I had some knowledge of this case prior to coming in. And my question today, it is a general question, but it starts with this particular case. In reviewing the 22-page report and basically piggybacking off of my esteemed colleagues' questions about interagency cooperation, I noticed that in those 22 pages, at no point did anyone from DCFS call the Will County State's Attorney's Office. And the reason that I asked this question is because I'm personally aware as a prosecutor of how many times creative solutions come up to deal with situations, starting with a phone call from an investigator that starts, "Can I run something by you?" And so it seems as though in this particular situation, despite the repeated interactions between DCFS and the house at 309 Lewis Street, at no point was the juvenile chief involved. And I've known the juvenile chief for over 20 years, and her ability to come up with creative solutions, I think, is probably unparalleled statewide. So my question is, are you aware, is there any sort of culture that basically causes DCFS investigators or other DCFS personnel not to want to call the state's attorney's office to attempt to perhaps come up with these creative solutions or the agency cooperation that the other members have asked about today?
I don't know that it's a culture, and having went out to Joliet and met with the judge of the juvenile court myself and listened to some ideas and some things that we're going to look at from her perspective, and also Judge Martin in Cook County, her perspective with regard to the work we're doing. Here's what I would say, is that in this case, the problem was too many eyes and hands and episodes rather than a stream of work that could be, somebody could at a certain point say, and back to the senator's scale, boy, it looks like we're at about a 6 or 7 on a 10-point scale of concern. Perhaps we should escalate this puppy up and ask somebody else to take a look at it, take it to the state's attorney, think about what we might want to do. Hindsight is always 20/20. That should have happened, quite frankly. It should have happened. It did not. And so what we're going to try to do is not institute to Senator Hunter's comments a whole bunch of new initiatives. Even 360 is not an initiative. It's good, standard, collaborative casework on behalf of really high-risk cases. That's what it is. It's nothing more than that. And when we get to those kinds of cases, I think we ought to be having a conversation, not to bring kids into care necessarily, but how do we get the court and our work all of one accord around what ought to happen, and how do we bring that accountability to the situation? I'll be honest, when I heard that we had no authority to do background checks on unknown males answering the door at this address, I was flabbergasted. What? Are you kidding me? But we don't. And so getting to the court, in this case, at a certain point before this little girl died, was something we should have considered. It didn't happen because different people were looking at the situation at different times. It wasn't that the people looking at the situation were all clueless or didn't understand. They were just looking at it at different times, and it looked different and maybe even marginal, but okay. And by the time it was spinning out of control, it was out of control. So I take your point, and certainly I'm initiating conversations with the juvenile judges about how we can become more aligned and in tandem. My biggest concern will always be, and I think that's probably somewhere under the surface of the culture, as you say, that will mean a flood of kids coming into care. And what it should mean is that a flood of families get more help. And that's what we ought to be trying to figure out how to do. Under my leadership, that's what I'll be trying to figure out.
Thank you very much, Madam Director.
You're welcome.
Senator Biss.
Thank you, Madam Chair, and thanks, Director, for being here. I'll be honest, I wasn't planning on asking any questions. I wanted to come and be here and listen and learn, but I was kind of taken by Representative Irvin's comment about the fact that you're here 4 weeks in, and who knows how you'll be treated if there were a similar hearing a year from now.
Hopefully very nice.
Well, and that got me thinking, what would you want a hearing a year from now to look like? What would you hope to be telling us a year from now?
Okay, thank you. That's a great question. A year from now, my expectation is that we are running a practice, an end-to-end practice that allows us to be able to tell you when we're getting it done right and what caused that to happen, what we're still struggling with, and what kinds of things we're doing to deal with that, and that at the same time engaging you if there are any other open legislative issues that we haven't thought about. I want to be able at that hearing to say to you that when something doesn't go well, and I ran child welfare in Georgia for 7 years. I can tell you, no matter what we did, how well we did it, what kind of changes we made, this is an imperfect business. And what you are trying to do is get your outcomes that you have confidence that the best decisions are being made, even at times when those decisions don't result in the optimal outcome. So I will be hoping that we're laying out for you how we made it a curve, how we're changing the trajectory of what we do, not with a whole bunch of new ideas and programs, but just basic 101 casework on behalf of children and families, where we engage as many partners as we can in doing it.
And I appreciate that. My question is, how would you then ask us to, in a deep way, evaluate whether that's happened? So for instance, I think it probably would have been the case, on April 24th, 2017, that the then director of DCFS would have said, so far as I can tell, the case of Semaj Crosby is one that's been handled fine. That probably would have been the position of the department prior to the day of her death. And so a year from now...
I don't think so. It wouldn't have been my disposition. I can only tell you what I might have said. If I had read or understood everything that I understand about this case on the day before the child died.
Many of your comments earlier today have made the exact point that no one was really doing that.
Exactly.
And so how do we know a year from now that real careful, comprehensive analysis where the right hand and the left hand are talking to one another, and so the entire department really understands which cases are being handled properly, where there are problems, and has a plan to move the problem cases to a good situation. And we know that there aren't under the surface hidden problems that aren't identified because of situations like exactly what happened with Semaj Crosby.
I think we're going to have to be able to describe outcomes that we are achieving. There are outcomes about the work. It might be easy to think, oh, those are just federal indicators or whatever, but if you have a federal indicator of maltreatment in care, let's just take that one, that children, once they come into care, get maltreated again in care. That's just one federal indicator. If you had an indicator of 10 or 12% of your cases looking like that, and then a year later I come back and say to you, less than 2% of our cases are finding that, that's one indicator, one set of indicators to you that we are improving on what we're doing. If I can come in and say to you, here's what went wrong in a particular case, and here's what we've done to mitigate that in the future, that's another indicator to you. This business, as I experienced it for 7 years, every day brings up to the surface a new thing for you to take a look at and apply your best thinking around how do we make sure that we do this well. You're always improving in this business, never getting it right enough for external accountability, because one child is too many children who are experiencing that. So I would expect that you would expect me to show you indicators that we have improved on what are standard ways of measuring us, but also being perfectly candid and honest with you about what things we've learned over the last year and how we then approach that to get it into a better place. And what other things we may be still challenged by, but are still working on, and give you an indication of how we're working on them. That would be what I would hope would feel like you're never going to not have something to hold us accountable for.
Thank you very much.
Senator Nybo.
Thank you, Madam Chairwoman. Like Senator Biss, I had not intended to make comments or ask questions. This is a learning situation for me to hear about what's going on over at DCFS. But having heard testimony for the last 2 hours in what I've read and what I know about DCFS, Director, I think you have stepped into what can, in the kindest of circumstances, be described as an extremely difficult situation. I think we all acknowledge that. And as Leader Flowers mentioned, this is not a new problem to the agency. This is a long-standing problem. However, the bright note and the silver lining is that you seem to be the kind of person, if not the person, that may be able to really start fixing this agency so that we don't have tragedies like this happening as frequently as they do. So my only comment to you is I wish you the best of success and invite you, I know you've made the suggestion, whatever we can do as legislators to be partners with you. I'm very open to ideas, suggestions, proposals that you have. You always have an open door in my office, and I do want to be a partner and help us together solve this problem.
Thank you very much.
Chairwoman Flowers.
Representative Ford.
Thank you, Chairman and Leader Flowers. Just a few follow-up questions. And the first part would be rhetorical. I just want to go back and make it clear that I do believe that we have to look at the family as a whole and be less punitive and be punitive where needed. Because ultimately, our goal is to make sure that the family is able to come back whole and be able to go to work. Once we put a person in the criminal justice system, now they can't take care of the family and they will be dependent on the state forever. There is a such thing as preventable and non-preventable. So you're going to always have situations where this agency is going to have trouble. And so I'm just urging and encouraging preventable deaths from happening. And that's going to be based on our ability to change our hiring process and training. I mean, someone spoke earlier about how simple it is to show love and to take care of a family. Even if we hire more people under this current way of doing business, it's not going to be helpful. Do you think, now this is a question, do you think we have the best and highly trained staff that go out in order to do the job to protect families? Director. And should we revamp that?
I don't think you train people into this job. I think training matters for this job. But my personal philosophy, over the years, I've worked Illinois state government, Chicago city government, Georgia state government. As over those years, what I think I've come to when it comes to talking about the workforce is that my job is to make sure that I offer an opportunity to that workforce to both believe in mission, so to really understand and believe in why we're here and what we're doing and sign on to that. And my job is to make sure that what they need on that front line, they have. And if they don't have it, my job is to go get it. So my staff will tell you who work in the central office, I say the privilege of working here in this central office is that you get an opportunity to make sure the front line has what they need. So I don't want to hear excuses. I don't want to hear what used to happen was. I want to hear how can we change what we need so that we help the front line get it right. And so when I combine that with asking the front line, please bring your values to work. I want you to be on mission from a value point of view, from a belief point of view. I think that then training kind of rolls up on that. Then training becomes a window to what are the policies, the rules, what are the best ways of doing these things. And that training then comes to the table. But those two things have to happen first, because otherwise the front line says, yeah, I've heard that before, but nobody ever makes it easy for me to get it done. Now, it's not going to be easy for us to do that, but that's why we have the privilege of sitting in the central office administrative chairs, because that's the magic we're supposed to bring to the table.
Yeah. So I think that it's very important to know that even if a person has the tools and they're not evaluated and they're not capable, then they're not going to be able to use the tools. It's going to be important that we have highly skilled practitioners that understand best practices
Absolutely.
when they go out into the field. You're aware that there's a new RFP that's going to impact your department, is that correct? With the managed care?
Yes, I'm aware of it.
And I think it speaks to what I was talking about with behavioral health. There's going to be an individual, I think, an award. The Department of Children and Family Services and HFS is set to award a Medicaid managed care contract that will include a separate dedicated plan for health and physical contract. How is that going to work? Is that going to work in the benefit for your department?
Well, I've already meeting with Felicia Norwood and her staff next week, and I'm going to really come to understand the full spectrum of what's going on with that. The one thing I do understand about it, or two things actually. One is that we will have a dedicated agency for our, operating our managed care. That will make, I think, based on what I know about it so far, it to be a more manageable thing for us to make sure that we're getting what we need out of it. But secondarily, we also will not start up for another year. So we have until 2019 to make sure we're sitting down, opening up everything, thinking about what we need to have and how we want it to work, and putting that in place. So I would expect to be able to talk more about that as time goes on, but that is where I am on that managed care contract right now.
And is it possible, we talked about what we expect to see, can it be as simple as doing what's right and making this a better system? And do you think next year, this time, or 6 months from now, we can say that we are on track to being the very best child protective agency in the country. Because we can't be afraid. We have to know that we can do this. Do you think we could do it?
Well, I'm not afraid.
Not you. I mean, we're all in this together. My question
Yeah.
is, can we do this?
Of course we
because
can.
there's been
No,
10 people that's been in your seat. And so the question is, can we do it? Is this something that we can do?
Of course we can do it. But it is a we. And so that we all collectively, the folks who work with and for me, we all have to come to the same notion about what it is that we're trying to do. But I will say this to you. The one thing I learned in 7 years in Georgia, and in the number of years that I worked here on a number of different initiatives across the city and the state, you cannot eat an elephant whole. You must eat it one bite at a time. So you have to, my job, let's just talk about what I'm accountable for. My job is to figure out what those bites are and lead staff to be able to take them. So some things are going to matter more than others to get done in order so we can move on to the next bite of the elephant. That's how we get there. And all of us have different bites and perspectives on this elephant that we will need to take. But my job and the job of the agency, and I think in 4 weeks, we've been taking some bites that have never been taken before, just in terms of management tools. And so we'll then begin, now that we know the information, we can see the score, now let's figure out what we have to do about it.
And thank you, Director. And unlike my colleagues, I did come with lots of questions. I'm not going to ask them all, but every time I think about DCFS, I just think about my nephews, my nieces, my cousins, and it could easily be one of them. If my sister, my cousin has a failure in their capacity. And so that's why I go back again and say that we do everything that we can to protect families and meet them where they're at. And I see a young lady in the room, and she's a beautiful little girl. If she could just stand, and she should know that we all love you, and we're here for you and all of your friends throughout the state of Illinois because we want to protect you. All right? Thank you.
Senator McGuire for a final question, then Chairwoman Flowers to close the hearing.
Thank you.
Madam Chair, thank you for the second opportunity. Director, earlier you mentioned the analysis of front-end services, which is being performed by Casey Family Programs. I was very pleasantly surprised when you recently told me in Joliet that Casey's first stop is the Joliet DCFS office. Yes,
and they actually were there 2 weeks ago. And we have a preliminary report from them on Semaj's case. And we certainly will be able to release that to you. Basically, they did a deep dive into the case files, giving us a national perspective on things and reflecting out loud for us some of the things that we need to look at. We were already looking at many of those things. I've asked them to continue over the next 2 months to do a full court press on the front end and to use this opportunity to open the window on that. And so I'll look forward to hearing from them. But be assured, every day we come to work, we are taking a look at everything that we are doing and turning it over to try to figure out how do we do it better, if it's the right thing to do, and how do we not do it if it's not going to give us value for children, their protection, and for the preservation of their families.
And when may we expect that report?
I'm going to ask them if they can do that within a 60-day, you're talking about the one we have now or the one in 60 days?
Casey's examination of the work of the Joliet office.
Yes, it is available today. We can give it to you.
Thank you. And I must ask, on behalf of my constituents and others about 5 specific issues in the Joliet office, and I mean this respectfully. If you simply want to answer yes or no in the interest of time, I think that the endurance you've shown at the witness table is a hallmark of people in your line of work. First, staffing and caseloads at the Joliet office. Is Casey evaluating staffing and caseloads?
They are taking a look, they took a look at it as a sidebar issue related to the Semaj case, yes, but we are looking at that statewide, and I do recognize that we have a challenge in the Joliet office. 4 weeks in, I know that that's one of the areas of the state where we have a challenge, and we have instituted all of the things that Desiree and Mike talked about earlier to make sure that we are not going to be experiencing the kinds of challenges that we had been. And I believe we're close to filling that gap.
Actually, the Joliet office is one of the locations that we're looking to try to overstaff, so that when we have people leave or vacancies occur or people that are out of the office for whatever reason, someone else can step up that is already trained to either take that position or assist.
And when we say overstaff, what we mean is that within our head count and budget, we are managing for coming in at head count and at budget. It's not going to be a budgetary issue. This is really a management of workforce issue.
Mm-hmm. There'll be that pipeline, as the director described.
Number 2, the case closing gift card competition that it was reported.
Gone.
In the Joliet office?
Gone.
Third, coordination with intact family services providers. I understand in Will County those are Aunt Martha's and Children's Home and Aid Society of Illinois.
Yes.
Is that coordination being addressed by Casey?
One of the things that they recommended to us was that we increase the coordination. Okay. The coordination is going to have to take place with Desiree, Alex, and the local staff there, and they'll be having some new information available to them so that they can manage that and really make sure that coordination takes place.
Okay. And utilization of local resources.
Absolutely, and one of the things that we're going to do is figure out what do we already have. I suspect at every office there's a list in a drawer somewhere of local agencies that do X, Y, and Z. There may even be a little database somewhere with that information, but over time people get busy, they don't think about it, it's not on their plate. We're moving that to core as how we ought to be thinking about casework. And so that means when we're dealing with a family, we're not only just looking for state and public resources, we're looking outside of that vortex. And again, I'm going to spend quite a bit of time with regional administrators, area administrators, visiting, talking. I spent 2.5 hours, I think, in the Joliet office a couple of weeks ago, trying to understand what the challenges are, helping the administrators get what they need to help the people who work with them get what they need.
And finally, the late filing of reports. I believe the Quality Assurance Review mentioned
yes.
Reports were filed, and they were supervisory reports, as I understand it.
So, let me have Desiree speak to that because I asked her to take a deep dive on helping us understand what that is.
So there was actually, I believe that the term reports was used, but it was not by quality assurance. That is actually note entry. So there's reference to reports, but the reference should be note entry, and there was indeed late notes entered into investigations by investigators that were working those reports. We'd take a look at that through the quality review as well as myself to determine the obvious integrity of the note being late, as well as whether it was supported, the content of that note supported by the activities of the investigation. And we did determine that. I did determine that on my review. So wherein a worker entered notes late, the supervisor who did enter notes on time, that content, that information was entered in a timely fashion, and the note supported that, and vice versa.
But let me say this one thing that it did raise for me. why Mike came to me in my 4th day and suggested that we reinstate what had been a standard practice that we hadn't been doing called practice reviews. And what these allow local administrative staff to do is monitor and track for inadvertent things, and especially for things like, are the notes in the file that we need to have to decide what to do for this family? And so by bringing people back together and having them on a call or in the room together, really pulling cases, opening them up, looking at what's in there, that's how you raise the standard of behavior around quality, is by doing that. Then all of a sudden people begin to realize, while it may seem like a small thing to them, it's not a small thing to the fate of the family and the child and the process. So those practice reviews, I believe, as we get more and more involved, are going to get us to become a better organization with a higher quality of not just note-taking, but responsiveness to that which we now know.
So are procedures now in place
Oh, absolutely.
to ensure that these notes, these reports are filed in a timely way and that their credibility is no longer subject to question?
We do have procedure on that. And as the directors referenced, we will have a heightened expectation through accountability and through our reviews and discussion. Those discussions will happen at a local level. What we are going to be embarking on, what we've actually started in Joliet, is a review of cases related to the categories that the director spoke of earlier, but also that will involve discussion with field staff, the supervisor, the area administrator, and it will be an interactive conversation about what is and is not in that. So the accountability and expectation for quality and again, efficiency.
You know what, and Senator, we probably have a policy or a procedure somewhere that says thou shalt put in timely notes. That's not what makes them do them timely. This process of supervision, I like to call it supervision of the work. Mm-hmm. When things get supervised, they get done. And so the policy is there somewhere, always has been. But now we've got the supervision coming to the table in a very interactive, concrete way that I believe is going to raise the bar on this question.
Thank you.
If I might add to the director's statements also, the new technology, the tools and the management, tools that are going to be available to us will assist with that as well.
Thank you.
Well, I just want to follow up on what you just said, because once again, I don't think you guys get the importance of what you just answered to. Fraudulent information, there's a law against that. Am I right? Am I right about, can someone answer me, please?
I am certainly sure there's a law.
No, I need to understand. Do you all understand that a worker cannot fraudulently put information in a file that wasn't there, or the date or the time that was indicated? Let me just ask this. Do you remember the case where a worker said that she had seen the child, but really she hadn't because the child was dead? Do anybody remember
I do
that?
recall reading about that. And I wanted to just say that indeed is fraudulent. What we have here is untimely, and our system does it does record when it was made, which is how we know they were not timely, but they were not asserting that an action had taken place that had not taken place.
But we don't know that. That person that reported that child was alive and well, according to that report, that child was alive and well, but it was only after the fact did we find out that the baby was dead. And so my point is, either you're going to be there to do your work or you're not. And if you're not, that's fraud and abuse. And I think, once again, I think I really get the impression that you guys really don't understand the importance of what it is that you're supposed to be doing. And therefore, as a result, that you don't get the importance of it, it doesn't trickle down. There's no heightened alert. There's no, I got to get this right. I got to dot my I's and cross my T's. Now, back in the day, when you were here before, Madam Director, it was a lot of handwriting. But now you could talk into your cell phone. You could talk into your mic on your app or your computer. But the fact of the matter is, this is very important. And I just want to go back. Did you change your mission statement? Have the mission statement changed since you've been the director?
No.
Okay. I just need for you to take a look at your mission statement. The last time I read it, I had some concerns with it, and I'm not going to address that now. And I just want to say, with all due respect, in regards to Semaj's case, I don't think there's anything in the report would have given us any indication. In this report here that I have, there's nothing on these pages up until the day before she died. There is nothing that would have given us any indication that this baby would have been found dead. Absolutely nothing. So I'm not expecting you to anticipate, but you can know that if you don't provide the services, if the reports are just sitting in a file and no one is doing anything about it, if the mom says, I need help, or my child need her medication, or I don't have my Medicaid card, or if you know that these workers are overworked and underpaid, if you know that the DCFS, the people that we're supposed to be servicing, that you don't have the tools that you need, and if you don't ask for help, we're all going to be in trouble, and we're going to be right back in the same place that I know I was at in 1985. I don't want to be there anymore. I want the best interest of the child. I want the services. And I want to ask you this, what about all these different agencies that you're contracting with? Do you know that the people that's working for these private agencies, do you know that they're trained properly? And was this not a private agency that went to visit at Semaj's home? And the protocol, not only for the DCFS workers, but the protocol for the other workers and the people that you contract with, don't you think that need to be called in? They need to be questioned. Their contracts need to be reviewed. And there are standards. There are standards. All we have to do is follow them. And the only thing that I could possibly, and I'm not being funny about this, but this is the only new technology, but there should be an app for every state agency that these families need. You know why? Because there's federal and state dollars that's paying for this. That bed that was ordered, that was paid by the state. I don't know what fund it came out of, but someone should have put that bed up. If the report has indicated that the mother has a condition, what in the world made somebody think that they could just drop off a bed in a box and think someone's going to put it together? And Madam Director, you want to investigate everyone in the house that opened the door? See, I think that's how we lose sight of the purpose of being there. As I told you before, Semaj's mother, her Social Security benefit was a payee to someone else. That wasn't the immediate issue. And you would have known that had someone came in and asked all the pertinent questions. And let me just give you another example of the reason why we don't need to reinvent the wheel. Because according to the procedure for the Illinois Department of Children and Family Services, 302-388-30, it has engaging and partnering with the Family and Social Network Report. It's here. It is here. I promise you, I have read it throughout the years. It's all ensuring the family member identify the specific individuals included in the family. See that? You don't have to do an investigation. It's number one. It's letter A. Letter A. Creating an overall environment that conveys respect toward the family and consideration of the family needs. It's all right here. Regular sharing of accurate and understandable and complete information. It's all right here. That's my point. And I'm not going to belabor your time anymore because it's already in the statutes. It's already a part of the procedures. And the only thing I'm begging you to do, I'm begging you today, please, let's protect all the children to the best of our ability. And we have no idea what happened to this baby. We don't know if it was a medical condition. We don't know if someone actually caused harm. But we can say for sure that she did not have her physical. According to the report, had someone read it, it showed that she had not seen the doctor from 0 to 3. That's what's in the report. That is the wellness of that category of services for toddlers from 0 to 3, she didn't have it. And we can be assured of that because we do know that the 7-year-old didn't have his medication. So with that being said, this committee will be at recess to the call of the chair because I do anticipate having other hearings because I have not spoken to you about the juveniles. I have not talked to you about the 1115 waiver. And there's a multitude of issues that has not been addressed. But this is something that I'm going to help you with. And I'm going to help you by constantly engaging you and knowing that you're going to have to come before this committee. Thank you all very much. And is there any further business to come before the committee? Seeing none, this committee will be at ease to the call of the chair. Thank you.